Medicare just sent out a memo, not to you, not to the public, but only to insurance carriers, saying they're finally going to fix one of the most frustrating parts of Medicare.gov, the provider search. I got a copy because, as you know, I'm a bit of a Medicare insider. And let me tell you, the way they're rolling this out is half-cooked. Medicare, if you're going to fix a tool millions of older adults and caregivers rely on, don't do it halfway. Do better. Let me break down what's in this memo and what it means for you and why I'm skeptical this will solve the problems I wrote about years ago in my first book, Prepare for Medicare, The Insider's Guide. Starting in 2026, Medicare says its Plan Finder tool will finally include provider directories. That means for the first time, you'll be able to type in your doctor's name and supposedly see which Medicare Advantage plans include them. But here's the catch. According to the memo, it will only apply to local coordinated care plans, regional PPOs, medical savings accounts, and private fee-for-service contracts. Have you ever even heard of most of those? Nope. So if you're thinking, wait, where are all the HMOs? You're right. HMOs, which most people are actually on, aren't spelled out in this rollout. And when you look at the numbers, it gets worse. Regional PPOs, MSAs, and private fee-for-service, or PFFS, together make up maybe 1 or 2% of enrollment. 1 or 2%. So unless every HMO inside those local CCPs is included, Medicare is hyping up a fix that barely touches the people who actually need it. Leave me a comment below. Did you even know those plan types existed? Or are you, like most people, just trying to figure out if your doctor is in the network you want? So what does that mean for you? Well, if you're in a regional PPO, and that's maybe 1% of the market, you might finally see your doctors in the tool. But if you're like the majority of Medicare Advantage enrollees in an HMO, you're still stuck with the same broken directories and outdated PDFs you've always had. That's not a fix. That's a partial rollout that makes the system even more confusing. Would you even trust this tool if Medicare rolled it out tomorrow? Let me know in the comments. And here's why this matters so much. In the very first edition of my book, Prepare for Medicare, The Insider's Guide, I spelled out the flaws in Medicare.gov. Broken provider search, directories that never matched reality, formularies changing every January with no warning, ghost networks, doctors listed on paper but not actually taking patients, and no meaningful help navigating dozens of plan choices in every county. Well, that was over 4 years ago, and now instead of a full solution, Medicare is giving us a partial rollout that may only help 1 or 2% of people. That's not progress. That's confusion. And here's what really bothers me. Medicare isn't even building this themselves. They're outsourcing the entire project to a third-party vendor. So carriers will upload weekly files, the vendor hosts the data, and Medicare just displays it on their website. But who's minding the store? Who's validating that the information is right? Are the phone numbers current? Are the doctors actually taking new patients? Are ghost networks being scrubbed out? The carriers? Well, they've struggled with this for years. The vendor? They're just a middleman. Medicare? Nowhere in this memo do they commit to verifying the quality of the data going into their tool. So what do we have? A new search function, but still no quality control? Garbage in, garbage out? Have you ever called a number in a provider directory only to find out it was wrong or disconnected? Drop a yes or a no in the comments. I know I have. Medicare also says it's going to improve how supplemental benefits are displayed. Instead of just saying some coverage or no coverage, the Plan Finder will now show cost sharing, authorization requirements, and limits for 30 existing perks, plus a handful of new ones. Well, that's been needed for a long time. It sounds nice, but here's the reality. If your plan is already cutting back meals, rides, or OTC cards, a prettier chart doesn't make those benefits more valuable. You guys ever actually use those benefits, like those cards or those rides to the doctor? Or do they sound better in ads than in real life? Let me know in the comments. And then there's the AI-powered drug search Medicare says they're rolling out. Well, that's the buzzword in this memo, AI-powered. Here's what they're promising. Starting in 2025, you'll be able to log into Medicare.gov, type in your prescriptions, and see personalized pharmacy prices. Sounds futuristic, right? But let's be honest, formularies reset, every January. Pharmacies change their prices week to week. AI doesn't fix that. And here's the kicker, this only works if you're logged into your Medicare.gov account, which means your personal health data is being piped through who exactly? Another third-party vendor? The memo doesn't say. So we've got a shiny AI label, more outsourcing, and more of your private data going into black boxes, but no clear accountability for accuracy or privacy? What do you think? Do you trust Medicare with your data, especially when they don't even name the vendor? Comment below. Here's the truth. Even with all these upgrades, Medicare.gov still can't do what independent agents do. A website or an AI tool can't call your doctor's office to confirm they're accepting new patients. It can't explain whether a supplemental benefit is worth anything beyond the fine print. And it can't sit down with you, listen to your needs, and help you find the plan that fits your health, your budget, your risk tolerance, your travel, and your lifestyle this year and in future years. Well, that's what independent agents do. That's what Nikki and her team do at Brickhouse Agency every day. So here's my message to Medicare. If you're going to fix the plan finder, don't do it halfway. Roll out a full solution. Validate the data. Make it comprehensive, not partial. If you want real help navigating Medicare right now, go to brickhouseagency.com and book a free consultation with Nikki and her team. No obligation to enroll. If you want to dig deeper, grab my book, Prepare for Medicare, The Insider's Guide. I laid all these flaws out years ago, and they're still here today. And if you'd like to get insider updates before they hit the headlines, sign up for my newsletter at prepareformedicare.com. Because at the end of the day, shiny websites and AI tools don't protect your health or your wallet. Experienced independent agents do. Here's to your wealth, wisdom, and wellness.